Hello everyone, my name is Dallas Ulibarri-Vering, and today we're going to discuss breast cancer in women 65 and older and the different treatment plans available. Here's an overview of breast cancer in women 65 and older. So more people are living longer, which leads to more health risks among the elderly. It's important to continue receiving annual health checkups with your physician, especially women 65 and older, due to the increased risk of developing breast cancer, cervical cancer, and other health complications linked to aging. One main concern, and one of the most common forms of cancer diagnosed in women 65 and older, is breast cancer. This is why it's important to know your family's health history and if breast cancer is common within the family. Taking proper caution by receiving annual and biannual mammograms is one preventive measure women can take. By receiving your annual mammogram, doctors can detect early on if there's any form of breast cancer present. Following being diagnosed with breast cancer, the next step is conducting a treatment plan with your physician. Along with conducting a treatment plan specific to the patient's condition, it's important to discuss the impact it has not only for the patient but the entire family system. Interventions for the patient and their family is one way, and another one is support groups to better cope with the diagnosis. Now we're going to discuss breast cancer in more depth. So as women begin to age, their chances of developing breast cancer increases. The average age of a breast cancer patient being diagnosed is 63 years. Most women in the United States who die from breast cancer is 65 years and older. When evaluating older patients with breast cancer, a key issue is whether the cancer is a main illness for the patient or if there are other underlying health issues as well. An example can be some patients who have a certain stage of cancer may also have high blood pressure, dementia, and other health complications. Therefore, in older patients, it's critical to identify the most important medical problems, and also having other health complications along with breast cancer can affect the overall outcome of their surgery, and as well as any other surgeries if needed. Next, we're going to be discussing the diagnosis of breast cancer in elderly women. The diagnosis of breast cancer in older patients is at a more advanced clinical stage when they are diagnosed. Some factors that are associated with the delay in diagnosis of breast cancer, one factor could be the lack of annual mammograms and self-breast exams. Less than 30% of women older than 70 are screened regularly with mammography. Another factor is the expensive mammogram screenings. Many older women live off a fixed income with many insurances like Medicare who refuse to pay for annual mammograms. Another factor is elderly women are more resistant to the idea of annual mammogram screenings because they have a fatalistic mindset when it comes to health-related matters. Following the diagnosis of breast cancer, you need to discuss with your doctor the different treatment plans available to you, considering the biology and behavior of the cancer. Treatment plans and recommendations are personalized to that specific patient. Factors in determining what type of treatment are the stage of the tumor subtype, including hormone receptor status, specific tests to eliminate the risk of the cancer coming back, the patient's age, general health, the patient's menopausal status, and presence of known mutations in inherited breast cancer genes. When dealing with the diagnosis of breast cancer, there are some treatment plans and technological advances that we can use in order to help treat breast cancer. So by removing early stage breast cancer, doctors will surgically remove some healthy breast tissue around where the tumor was, as well as the tumor. The reason why they're going to remove some of the healthy tissue around the tumor area is to prevent the cancer from coming back. For more aggressive breast cancer, doctors may recommend neoadjuvant therapy, which includes chemotherapy, radiation therapy, targeted therapy, and hormonal therapy. Due to the technological advances, researchers have conducted a study with the Savvy Scout device. The Savvy Scout device is a small medical device that surgeons use during surgery to locate and remove target tissue during surgery. The way that the Savvy Scout works, it's a small device which is called a reflector that is placed into the lump within 7 days of the initial surgery. It uses electromagnetic waves that are non-radioactive to detect the location of the reflector within the breast. During the surgery, the doctor will be able to locate the reflector and the lump and will remove both. The benefits of this device are it provides a more accurate location of the lump and it minimizes the use of radiation. Along with the Savvy Scout device, there are other treatment options for the patient. Another form of treatment is breast conserving surgery. This allows the patient to still have part of the breast intact after the initial surgery to remove the tumor. Doctors advise against breast conserving surgery for women who have a family history of breast cancer because this may cause the breast cancer to come back more aggressive than it was before. Discovering that you or your loved one has been diagnosed with breast cancer has a major impact not only on the individual, but the family system as well. Studies have shown that discovering this news, it affected the family members more so than for the actual cancer patient. This is where support groups and interventions take place for the patient as well as the entire family. One support group that I found to be beneficial for the patient is the Cancer Treatments of America. It's a great website and support group for the patient. They handle medical and non-medical aspects of the patient's care as well as the quality of life after the diagnosis and treatment. Another support group is CanCare, Fighting Cancer with Hope. They provide free and confidential emotional support and resources for those currently facing a battle with cancer as well as for their families. So after being diagnosed with cancer, it's important to seek treatment, the best treatment option for you. Also, in order to prevent it from happening to yourself, is to get annual breast exams as well as self-breast exams. Another thing is the support from your loved ones and caregivers, as well as interventions for the entire family.